Good morning, my name is Jorge Contreras-Saldarriaga. I'm a physician and internal medicine resident from Universidad de Cartagena, Colombia. I'm part of the investigation group called Salud de la Mujer, and in the next few minutes I will present you this work named Prevalence of Sarcopenia with the SARC-F screening scales in its SARC-F+CC and SARC-F+E+IMC versions in Colombian women. It was elaborated by Alvaro Monterrosa-Castro, physician, gynecology and obstetrics specialist, who is the leader of this group, Diana Perez-Romero, a student of Universidad de Cartagena, and by me. I have no conflict of interest or financial relationships to disclose. I'm going to start presenting the context of this work. First, sarcopenia is defined as the loss of strength in muscle mass, and it's a condition that becomes more common with age. There are some criteria that define the concept of sarcopenia, and there has been suggested some screening tests for it. One of the most used tests is the SARC-F scale that assesses 5 different items: strength, assistance to walk, rise from a chair, climb stairs, and falls. I will explain you this with more detail later. There are other versions that have been validated to improve the diagnostic capacity of the SARC-F scale that use the same criteria but consider other parameters. These are the SARC-F+CC and the SARC-F+E+IMC. The first one takes into account the calf circumference measured in centimeters, and it also has two versions. One that uses a cutoff point of 31 centimeters, and the other one that uses a cutoff point of 33 centimeters. The second scale is the SARC-F+E+IMC, which additionally includes the age and the BMI. Everything I mentioned is important because there are not enough screening studies on sarcopenia in Latin American women who have biological, psychological, and social conditions that differentiate them from women from other latitudes. So the objective was to compare the prevalence of sarcopenia identified with SARC-F and the other versions, SARC-F+CC, with the two cutoff points, and SARC-F+E+IMC. This is a cross-sectional study that is part of the project Quality of Life in Menopause and Colombian Ethnicities, CARIMEC. We took women 60 to 75 years old, black or mestizo race, residents in the Caribbean or in the west of Colombia. They were invited to participate in their own homes. We applied a questionnaire that included information about women's medical history and some anthropometric measurements that include the calf circumference and BMI. EpiInfo was used for the analysis. The quantitative variables are presented in means and standard deviation, and qualitative variables in absolute values, percentage, and 95% confidence intervals. This was an anonymous and voluntary study endorsed by the Universidad de Cartagena, Colombia. Finally, the p-value that we determined as statistically significant was less than 0.05. The main outcome measures were, first of all, the SARC-F questionnaire. As I said before, this is a scale that evaluates 5 items: strength, demonstrated by having problems with lifting and carrying 10 pounds, assistance to walk, if the person needs help walking across a room, rise from a chair when the person has difficulty transferring from a chair or bed, climb stairs, if there is any difficulty climbing a flight of 10 stairs, and falls if the patient has presented any fall in the last year. Each item has 3 answer options, where 0 is a negative answer, 1 means that the patient has some kind of difficulty, and a score of 2 means that the patient has a lot of difficulty or is unable to do this specific activity. The total possible score is 20 points. If the participant has a global result of 4 or more points, She's classified as having sarcopenia. As I mentioned before, there are other scales that have shown to improve diagnostic capacity. Both of them include the same parameters of the SARC-F scale, but additionally include another variables. The first of them, the SARC-F+CC, also called SARC-F6, includes the calf circumference and has two cutoff points, 31 and 33 centimeters. If the contestant has less than 31 or 33 centimeters in the calf circumference, it gives 10 points, but if she has more than 31 or 33, it grades 0 points. The total possible score is 20 points, where having 11 or more is defined as sarcopenia. The second one, that is the SARC-F+A+BMI, includes the age and the BMI. The cutoff point for the age is 75 years old. If the participant has less than 75 years old, it grades 0 points, but if she is more than 75 years old, it gives her 10 points. For the BMI, the cutoff is 21 kilograms per square meter. If the person has a BMI less than 21, it gives her 10 points, and if she has more than 21, it grades 10 points. So the overall scoring is 30 points, where having 12 or more is defined as sarcopenia. So these are the results. We included 700 women in total between 60 and 75 years old. In this table, we can see the basal characteristics. They are presented as mean and standard deviation for qualitative variables, and in absolute numbers and percentage for quantitative variables. I'm going to mention the most relevant of them. The average age was approximately 67 years old. The mean BMI was 26.5 kilograms per square meter. The mean calf circumference was 34.1, and we also divided the results of our sample into 3 groups according to the age category, where you can see that most of the women, specifically 314 or 44.8%, were in the group between 60 and 65 years old. With regard to the ethnicity, there were 300 patients of mestizo race, that is 42.8% of the total, and 400, that was 57.1% African descent. So sarcopenia was found in 69 patients with SARC-F scale, that is almost 10% of the total sample. When using the SARC-F6, also called SARC-F+CC, we found sarcopenia in 22 women that were 3.1% of the total, with the 31 centimeter cutoff point, and 31 women, that is 4.4% with the 33 centimeter cutoff point. Finally, sarcopenia was found in 7.7% of women that were 54 in total with the SARC-F+A+BMI test. Our conclusions were the following. The first thing we can conclude is that in a group of Colombian women, the presence of sarcopenia was similar with different versions of the SARC-F scale. Second, in women in their communities of residence outside of hospital environments, there were a greater number of women with SARC-F and fewer with SARC-F+CC with a cutoff point of less than 31 centimeters, who meet screening criteria for sarcopenia. Thank you for watching this lecture. In this picture, you can see some of the members of investigation group Salud de la Mujer, and you can access to our webpage in the link that is presented. Thank you very much.